All right, welcome to The Explainer. Today, we're going to play medical detectives and dive into a really serious and often super stealthy condition called mesenteric venous thrombosis.
So to get our heads around this, let's start with a simple question. Imagine a major highway leading out of a huge city. Now, what happens if that highway gets a total unmovable roadblock? It'd be chaos, right? Traffic backs up, supplies can't get out, it's a disaster. Well, that's pretty much exactly what's happening inside your body with this condition.
So here's how we're going to break it all down. First, we'll set the scene and understand the problem. Then, we'll hunt for the causes, look at the big diagnostic breakthrough, explore how we treat it, and finally, wrap up with the outlook and the big takeaway.
Okay, let's get right into it. What exactly are we dealing with when we talk about this internal traffic jam?
Here's the bottom line. Your intestines are working non-stop, and they need blood to flow smoothly. The superior mesenteric vein is the main highway for draining that blood away. MVT is what happens when a blood clot forms and blocks that critical highway. Simple as that.
Now, this is where it gets really interesting, because MVT is part of a bigger picture. The whole problem of restricted blood flow to the intestines is called mesenteric ischemia. And as you can see, MVT is the culprit in about 16% of the really sudden acute cases. So it's not the most common cause, but it is absolutely a major player in this very dangerous game.
And this right here, this shows you just how serious this is. We're talking incredibly high stakes. When that drainage pipe is clogged, pressure builds up, the blood flow grinds to a halt, and the tissue in the intestine can literally start to die off. That tissue death, or infarction, is the most severe and often fatal outcome.
Okay, so a clot like this doesn't just appear out of thin air, right? Our medical detective story needs suspects. We need to figure out the underlying conditions that set the stage for this to happen in the first place.
And wow, check out this number. This is a huge clue. In a staggering 90% of cases, MVT is secondary. All that means is it's caused by some other pre-existing condition. So that tells us to really understand MVT, you've got to look at the whole picture of a person's health.
Think of this first group of risk factors as, well, local troublemakers. We're talking about direct injury or inflammation right there in the abdomen. Things like surgery, getting into an accident, or having severe inflammation from conditions like pancreatitis, all of that can damage the vein and kickstart a clot.
Our second category of suspects is all about creating that traffic jam in the veins. You've got conditions like portal hypertension, which is basically just a fancy term for high blood pressure in the veins around your liver, something you often see with cirrhosis. That creates a backup. The blood flow slows way down, and that makes it a whole lot easier for a clot to form.
And finally, our third group of suspects isn't about an injury or a traffic jam. It's about the blood itself. Some people just have conditions, either inherited or that they develop later, that make their blood extra sticky and more likely to clot. This is called thrombophilia, and sometimes it's a hidden danger until something serious like MVT actually happens.
So, you've got all these suspects lined up, right? You'd think this would be an open and shut case, but nope. MVT is a master of disguise, which brings us to the trickiest part of the whole investigation, actually diagnosing it.
You know, the first clue doctors get is, well, it's almost a red herring. It's not that sharp, specific pain that screams emergency. Instead, it's this dull, all-over bellyache that can drag on for days, even weeks. The patient might not even seem that sick at first, which makes it incredibly tough for a doctor to figure out what's going on just from a physical exam.
But just when the case seems to be going cold, we get our breakthrough. There is one piece of technology that completely changes the game. And that, my friends, is this CT scan.
And this number, 100%, it just says it all, doesn't it? One study found it had a sensitivity of 100%. That means it spotted the clot correctly every single time. This amazing tool cuts right through all those vague symptoms and gives doctors a crystal clear picture of the blockage. It makes the diagnosis definitive. Case closed.
So, once you have that crystal clear diagnosis, bam, the clock starts ticking. The investigation is over, and it's a race against time to intervene and fight back.
Okay, so when it comes to treatment, there are really two main paths. For most people, the first line of defense is medical. They immediately get anticoagulants, blood thinners, to stop that clot from getting any bigger and to prevent new ones from forming. But if things are really severe and the intestine is already in danger, then surgery becomes the only option to go in and remove any damaged tissue.
All right, so after that really critical intervention, what happens next? What does the future look like?
This is where our story really shifts towards hope and, a long-term strategy.
I mean, this is just incredible. The outlook for MVT has gotten so much better. Today, the 30-day mortality rate is down below 10%. That is a huge drop from what it used to be. And why? It's all because of early diagnosis with CT scans. It lets doctors jump in with treatment before the damage becomes permanent. It's all about catching it in time.
And that recovery, it's not a one-and-done thing. It's really a long-term commitment. And it's all about one thing: prevention. Depending on the original culprit, that suspect we identified earlier, a patient might be on blood thinners for about 6 months, or maybe even for life if they have one of those underlying clotting disorders. The goal is to make sure this never, ever happens again.
So when you boil it all down, the big takeaway here is just amazing. The ability to see the problem with technology, like the CT scan, completely rewrote the story for mesenteric venous thrombosis. It turned what was once a mysterious killer into a manageable condition. It's such a powerful reminder of how far medicine has come, and it leaves you with a really fascinating question to think about. What other medical mysteries are out there, just waiting for that one diagnostic breakthrough to solve them?